The purpose of this presentation is to give you an idea of what to expect during an allergen skin test. We want to put you at ease for this test. Skin testing is an important step towards discovering what you're allergic to.
Alright, Kate, so Dr. Taylor has ordered some allergy testing for you today. Have you ever seen testing before?
No.
No? Okay, well let me show you how it works, alright? What we have here in this little container are liquids. Each one of those liquids has proteins in it from the major things that people are allergic to. And you can kind of see on here there's dust mites, dogs, cats, and then all the different molds and trees and grasses and weeds. And what we do is we take one of these little plastic pieces that's sitting in here, and what we do is dip it into the serum, and you can see it's a little prickery on the end. Okay, we dip it into the serum and then we just scratch a little bit of the serum into your skin. So you can see it's not like a needle, it doesn't draw blood or anything like that. Okay, the first two that we do are what we call controls. Alright, this is the negative control. It shows us what a negative or not allergic response looks like, and that's just like salt water. So when I scratch that, it's not going to do anything but leave a little scratch mark. Okay. The second one is our positive control. It shows us what a positive or you are allergic result looks like. It has histamine in it. That's the stuff a mosquito puts in your skin. It's the same thing that's released when your body's allergic to something. So that's what's so real irritating. Makes your eyes itch, makes your nose run, all that kind of thing. And on your skin, it'll make like a little mosquito bite. It'll get welted and red and itchy. Okay. That'll go away after I wipe it off, but it'll be a little itchy for a little bit until we're done with the test. Okay. The rest of these, if you're not allergic to, let's say, the ragweed, then it won't do anything. It'll just look like the saltwater one. But if you are allergic to it, once that stuff gets in your skin, it'll have that allergic reaction. It'll make histamine, and it'll get all red and welted and itchy like this one. Okay? And it takes about 15 minutes to get our answer, all right? So what I need to do is I need to use your back because I need a nice flat surface so the little drips of serum don't drip into each other, all right? So you'd be okay with laying on your belly on the table for about 15 minutes?
Yeah, sure.
Okay. So the first thing I have to do is just wash your back off with a little alcohol, okay? So it's just a little bit cold here for a minute. And then, once that dries a sec, I've got to mark which test is which on your back here with my little purple marker here. So you're going to have some purple polka dots on your back. Alright. Alright. So here we go. Are you ready?
Yeah.
Alright. Okay, these are the controls here. And then we'll start all the rest of them. All done. Now we just got to set the timer for our 15 minutes and we'll see what we get. Okay, Kate, well it's been about 8 minutes, so I'm going to wipe off the two controls and then I'm going to measure how much redness and welting there is at that positive one. Okay. Just got a ruler here, so that's not going to scratch you or anything. Okay. And I can wash that off in just a minute. And at least that one won't quit itching you quite so much. Feel good to scratch that one?
Yeah.
Yeah. Okay, so we just got about 7 more minutes left for the rest of them, and then we'll measure those and then you'll be done.
Okay.
All right, girl, we're at about 15 minutes. I'm going to get a tissue and wipe this off, and we're going to measure what's positive there. think the rest of them look pretty negative. They all look like the saltwater ones, so we can just scrub them off now. We just got to take that alcohol again and, whoops, wash the back off a little bit. I bet that dust mite one is pretty itchy, huh?
Yeah.
Yeah. It'll feel better. And the itching from that, now that I've scrubbed the histamine off, the itching should be better in about a half an hour. But if it's really bugging you, we can probably get Dr. Taylor to order a little bit of Zyrtec or Claritin or Allegra or something for you. Okay, there we go. So let me tie this for you and you can sit on up. And we'll give Dr. Taylor the results and she'll go over that with you. All set?
The purpose of allergen skin testing is to help find out what you're allergic to. It is important that you stop taking your antihistamine at least 1 week before your skin test appointment. An area of skin on your back will be used for testing. You will feel scratching sensations during the test and some itching too. Positive reactions will fade and we will keep you as comfortable as we can. If allergens are identified, work with your healthcare provider to determine the best actions for you to treat and prevent allergy. Thank you for choosing the Mayo Clinic Asthma and Allergy Department.